और इस प्रोग्राम में एकेडमिक एक्टिविटी में हमने आज मौजूद है। आज की जो हमारे शख्सियत हैं का नहीं है। प्रोफेसर बिल्कीस मेडिकल यूनिट और मेयो हॉस्पिटल में हेड ऑफ डिपार्टमेंट मेडिसिन है। इसके अलावा फोकल पर्सन है कोविड की और टेलीमेडिसिन की। प्रोफेसर बिल्कीस ने जो 1.5 साल में कोविड के बारे में पूरे पाकिस्तान में और ख़ासतौर पे पंजाब में अपनी खिदमात सर अंजाम दी, वो उनका एक अपना इमेज है। तो मेरी गुजारिश है प्रोफेसर बिल्कीस से कि वो आज अपने लेक्चर को शुरू करें।
वेलकम प्रोफेसर बिल्कीस, थैंक यू। प्रोफेसर साहब आप अनम्यूट कर दीजिए। वदीद आवाज नहीं आ रही है, व्हाट्स रॉन्ग?
मैम हर माइक्रोफोन चेंज कर दे अगर माइक्रोफोन।
प्रोफेसर बिल्कीस साहिबा आपकी आवाज नहीं आ रही है, आप बिस्मिल्लाह कीजिए। प्रोफेसर साहिबा यू कैन स्टार्ट।
उन्हें मैडम कॉल करके देखें, मेरे ख्याल में उन्हें शायद हमारी आवाज नहीं जा रही। उन्हें मोबाइल पे अगर कॉल करके देखें, क्योंकि ऐसा लग रहा है कि हमारी आवाज नहीं जा रही, कि उनको कोई सेटिंग में इशू है।
प्रोफेसर मुलाजिम साहब प्लीज इनको कॉल कर दीजिए। प्रोफेसर मुलाजिम साहब प्लीज प्रोफेसर बिल्कीस को कॉल कर दीजिए।
जी मैडम, प्रोफेसर बिल्कीस साहब शुरू करें आज का प्रोग्राम। प्रोफेसर बिल्कीस शबीर।
उनको प्रोबेबली हमारी आवाज नहीं जा रही, उनका कोई इशू है वहां से, इसलिए फोन पे कॉल कीजिए।
मैं कॉल करता हूँ।
हेलो, हाँ जी, आपको आवाज आ रही है?
इसमें तो आ रही है, उसमें नहीं आ रही आवाज।
नहीं अभी आ रही है आपकी। प्रोफेसर साहिबा वी कैन हियर यू, आप शुरू करें।
मैडम उनको हमारी आवाज नहीं जा रही, उनकी हमें आ रही है।
प्रोफेसर मुलाजिम साहब उन्हें कह रहे हैं आ रही है आवाज।
हाँ जी, अब आपको आ रही है जी आवाज? जस्ट क्विक साउंड चेक। अच्छा जी, अस्सलाम वालेकुम जी।
वालेकुम अस्सलाम।
start? Assalamu alaikum. Just a quick sound check, Professor Salma. Can you hear me?
Yes, I can hear you loud and clear.
ठीक है जी.
जी
अस्सलाम
here
वालेकुम
we are hearing. We are hearing.
अस्सलाम वालेकुम.
Walaikum
अस्सलाम
assalam.
वालेकुम. औज़ु बिल्लाहि मिनश शैतानिर रजीम.
वालेकुम अस्सलाम.
बिस्मिल्लाह. रब्बि इश्रह ली सदरी व यस्सिर ली अमरी वहलुल उक़दतम मिन लिसानी यफ़क़हू क़ौली. First of all, I'm very grateful to the teachers of teachers, Professor Mulazim Hussain, Professor Salma Hundi, and there are so many other big names which I am seeing on the screen who are attending this Zoom meeting. I'm very grateful for inviting me for this talk. And honestly, when Sir, you rang me up, it was a huge honor and privilege for me. I'll be basically focusing my talk on the management, on the active management of COVID cases. As you know, I hope you can see the screen.
Yes, we can.
So basically, I was going across the statistics yesterday. Unfortunately, we are facing a huge surge, and the positivity rate is round about ranging between 8 to 9 point something during the last 1 week. And as far as Punjab is concerned, I'm working as Professor of Medicine at King Edward Medical University, which is affiliated with Mayo Hospital, which has been catering the maximum number of patients ever since the COVID-19 started. What we are seeing is during this wave, a huge upsurge during the last 7 to 10 days. Currently, at Mayo Hospital, there are about 160 patients, and unfortunately, majority of them, so there are only 14 patients who are immunized. Majority of them are non-immunized. So I think it's very pertinent and very specific of Professor Mulazim Hussain to have arranged this webinar at this occasion when we are seeing an increased upsurge. Lahore is facing a positivity rate around about 8 in a round figure. And as you know, Azad Jammu and Kashmir, more than 23. So let's see how COVID goes. These are just very, very good and pleasant memories of Azad Jammu and Kashmir. This was when we held the conference of Pakistan Society of Internal Medicine. And these were the early COVID days when the disease had just started. And we were as yet going and roaming about without the masks. This is a very interesting movie. This was, I wonder how many of the participants have watched this movie. This was made back in 2011 by one of the American directors. And very, very interestingly, it's about a lady who catches COVID while buying a hamburger. The hamburger is made of pig. And the pig farms had been infested by bats. And the bats somehow contracted this virus. CDC as yet knows doesn't. According to this, as the story goes, this case was investigated, and CDC as yet doesn't know how the bats contracted the virus. But there was bulldozing of some of the tree forests. The bat got disturbed. One of the bat dropped a contaminated banana into the pig farm, and this is how it entered into the human as a zoonotic. This is how the story goes, and then this lady infects her son, both of them die, and the movie was made back in 2011. I personally watched this movie in 2016, and at that time I was just thinking what a paranoid sort of a movie it is. But now if you watch this movie, and I would advise all of you to do that, you would find out how true it has been over the last 2.5 years. And very interestingly, they depict that in Atlanta, the CDC is coming into play, the WHO investigators are coming into play, And this is actually what is going on nowadays. So it's, in fact, one of the articles in one of the spam journals said that this might be a biological warfare because it was depicted back in 2011 by one of the American directors. So this is so interesting to watch this movie, and I would advise all of you to do that. So abhi bhi ye sawal aata hai कि is it real? Believe you me, yesterday I was sitting at Mayo Hospital OPD, and one of the lady presented. She was a diabetic, uncontrolled diabetic. मैंने उससे यूं ही पूछा कि आपने वैक्सीन लगाई है? तो she gave a very blank expression. She is a resident of Lahore, गांव से भी नहीं आई हुई, लाहौर के आउटस्कर्ट से आई हुई थी, और she gave me a very blank expression कि मैं उससे पूछ क्या रही हूँ. कहती है बाजी इंसुलिन तो मिल जाती है इधर. मैंने कहा नहीं, आपने वैक्सीनेशन लगाई है. उसको फिर भी नहीं समझ आई. And I had to tell her कि वैक्सीनेशन एक टीका होता है जिससे बचाव होता है इस इन्फेक्शन का जो कि आजकल कोरोना की फैली हुई है. क्या तुम्हें इस चीज़ का पता है? And she said no. So even in Lahore, in a big city like Lahore, अभी भी सवाल है कि क्या ये वैक्सीन होती है, क्या ये कोरोना होता है. बहुत सारे अभी भी हमारे पास मरीज आते हैं जो कहते हैं कि जी कोविड नहीं है. इवन हम लोग डिनाइल में हैं. Many of the patients I'm seeing nowadays are actually the healthcare professionals who received vaccination back in March, April. And they say नहीं मैडम ये कोविड हो ही नहीं सकता, मुझे तो एक दफ़ा हो भी चुका है, मुझे तो ये है. फिर उनको हमें बकायदा नहीं, ये तो PCR नेगेटिव आ गया है. Professor Mulazim Hussain has repeatedly talked about the positivity and the negativity of the reliability, sensitivity, specificity of the PCR test. And he has often talked about whether we should rely on it or not. We should rely on the clinical picture. We never treat the investigations. I can see less than 1 minute. I wonder whether this time would be extended. But anyways, I suppose the administration must have arranged something. Anyways, the question is it real? So it's very much real. This is the virus. But ये है, ये ऐसा लगता है, ऐसे फैलता है. We have been talking about various variants and various mutations over the last 1 month. The first infection, the first patient rather, came in Punjab, in Pakistan on the 26th of February. And since that time,